More than 500 truck drivers presented themselves to be tested in Miritini, Mombasa County, as part of the government's targeted mass testing drive. Now, only 100 of them were tested, an indication that all is not well. Despite setting a daily testing target of 3,000, the government has for the last 2 months failed to attain this target. And as our very own Dorcas Wangira reports, contrary to the picture being painted by the government, revelations that the institution that is mandated to carry out the exercise is broke and now seeking 950 million shillings is worrying.
500 truck drivers in the coast region availed themselves to be tested at Miritini Dispensary, Mombasa. This in spite of the residents' strong opposition to the drive, owing to the fact that the health facility earmarked is in a residential area. Of the 500 who showed up, only 100 were tested, as only 2 health officials were available to collect the samples needed.
Wakisikia sahi ambao babako ndereva babako na corona, yule mtoto unamweka katika hali gani? Sisi tukipimwa, si ati tupimwa alafu tukiingia kwa matatu tupate ugonjwa ndani ya matatu na tuko na certificate zetu.
The frustration by the truck drivers, a manifestation of the country's unpreparedness in conducting the critical tests needed to establish the extent of the infection in the entire population. The leading government agency in testing the samples, KEMRI, in a report presented before the Senate Ad Hoc Committee and the National Assembly's Health Committee on the COVID-19 situation in Kenya, painting a grim picture of Kenya's capacity to test. In the report, KEMRI states that for the country to effectively roll out the testing exercise, it requires 100 million shillings for hiring personnel to collect samples, 540 million shillings for replenishing reagents and research, and an additional 150 million shillings for equipment. KEMRI has laboratories in Kilifi, Nairobi, Kericho, Kisumu, and Busia, with a capacity of testing 100,000 samples per week. But all are working below capacity for lack of the much-needed reagents. The government says currently there are at least 8,000 kits available for the automated Cobas 8800 Roche machine, which should last at least 1 week.
And we have several other testing facilities within our national referral hospitals, within our research institutions that are spread over the country, and within the laboratories of our collaborators who are working with us across the country. And for most of these laboratories, for the COVID-19 response, the government has developed a resource plan for not only testing, but for all the requirements that we need for the COVID response.
Kenya has so far tested 35,432 samples since the first case of COVID-19 was officially reported on the 12th of March, which on average is a mere 742 tests per day. When the government announced increased automated and manual testing capacity on April 10th, the expectation was that the samples tested would be in the tens of thousands each day. However, the highest samples tested range from 1,330 on April 19th, 1,516 on Wednesday, May 13th, and 1,611 on May 9th. Voluntary mass testing in Eastleigh and Kawangware was called off unceremoniously for lack of equipment.
Our testing ability is not going to be constrained because of lack of resources to buy the reagents. Rather, it will be a lack of being able to access the reagents. I am, however, happy to announce
KEMRI expects to have 60,000 kits, both manual and automated, by Friday, but without adequate personnel to collect the samples, and at the end of the testing lines, it may take longer for Kenya to utilize the full testing capacity the labs offer. Dorcas Wangira, Citizen TV, Nairobi.